Story 1. I take a medication for seizures that is also used to treat mood disorders. I was never diagnosed with a mood disorder, but am pretty sure one was accidentally treated with the medication. The medication is called Lamictal, also known as lamotrigine. Story 2. Face blindness. When the stories circulated about Brad Pitt a few years ago, the description sounded exactly how I have felt my whole life. If I see someone I know in an unfamiliar location, I have great difficulty recognizing them, and it has caused me much embarrassment throughout my life as well as other awkward symptoms. Story 3. Obsessive-compulsive disorder. I have intense intrusive thoughts and compulsions, and I get stuck in rumination loops. It has been crippling over the past couple of months. This also causes other issues like difficulty falling asleep. People often think of obsessive-compulsive disorder as something quirky that just makes people germaphobes or neat freaks, but in reality, it manifests differently in different individuals and involves thought loops and distressing intrusive thoughts. Story 4. Connective tissue disease or some type of heart disease. My family had some unusual deaths that made me begin to wonder if something was going on. My aunt died of an aortic aneurysm. She was a non-smoker and very small. My mother had severe scoliosis that was not diagnosed until she passed away. My brother was diagnosed with Marfan syndrome and died of heart failure at 40. My grandfather had 2 heart attacks in his early 60s. My aunt told my mother about her symptoms before she suddenly passed, and they are exactly like mine. I have been to many doctors and was only told that I have tachycardia. I am being treated for it, but they could not find the cause. I am very sick all the time and am constantly dismissed. Story 5. Brain tumor. I have been having nearly constant headaches since November, but my doctor and a few others keep giving me antibiotics for a sinus infection. I became persistent with my doctor last week, and now I am waiting for a computed tomography scan. Obviously, it could be many other things, but brain tumors took my father and grandfather. Story 6. Dyscalculia. I get turned around easily, and my instincts with direction are notoriously bad. I can get lost in the simplest spaces and cannot retrace my steps. I have a terrible sense of distance. I struggle to do math in my head and only know multiplication up to 5. For the rest, I have to use tricks to figure it out. I do better with math that involves letters. Story 7. I definitely have anxiety. It is manageable most of the time, but can sometimes be debilitating. However, I have never been diagnosed. Story 8. Crohn's disease. I have almost every symptom listed, and it developed about 15 years ago when I was in my mid-20s. Story 9. Restless leg syndrome. I pretty much always feel the need to stretch my legs, even if I walk a lot, unless I am focused on something else. Edit. Thank you for the suggestions. I will be sure to try a few and see how it works. Mine is not too bad, so hopefully these will help. Story 10. Autism apparently manifests differently between males and females, although there is some overlap. I have lived long enough that a diagnosis will not really make a difference. However, it would certainly explain some things. Story 11. Perimenopause in my mid-30s. No one wants to acknowledge it, but no one denies it. Edit to clarify age bracket for context why this is not typical. Story 12. Idiopathic hypersomnia. No matter the amount of sleep I get per night, I still constantly wake up tired. The other night, I slept for 15 hours straight. My record is 19.5 hours without getting up. Every day is a bit of a struggle. Story 13. Astigmatism. Although very minor astigmatism, I mostly notice it when I go to the gun range and look through the red dot sight on my pistol. The dot starbursts a little bit, and I have the same issue with headlights on cars when I drive at night. It is not bad enough to need glasses, just enough to be a mild nuisance. Story 14. 18 years of chronic pain. Red areas on my upper body. The doctors always act like it is no big deal. One eye is swollen and appears lazy. They said people my age do not get that type of eye problem, but they also will not do the CT scan to check what is wrong. I can barely see to read or drive. I have been diagnosed with several other major health issues, but none have fixed or helped the original problems. It seems like they do not care about finding out what happened right after I gave birth almost 18 years ago. The moment the baby was born, I felt different. and symptoms have not improved since then. Actually, they get worse every year. I want to know how to fix or control my pain and lack of ability to move or walk normally. It is very frustrating because most of my issues are not visible, so people still expect me to act like a healthy person would. I have had doctors tell me, "You are too young to have pain," or "You look fine to me." Like I would choose to be in pain every day. I just want to know why and if it is possible to have a better quality of life than I have now. Story 15. It can be difficult to get a provider to tell you that you have narcissistic personality disorder. Many therapists and psychiatrists think it is better not to inform the patient. I figured it out on my own, and it was like pulling teeth to get confirmation. Story 16. Hard of hearing or partial deafness. Unable to afford an audiologist appointment. I have not been able to hear from my right ear for months, and I have had it professionally cleaned twice with no improvement. Story 17. Autism. I have confirmed it with many tests, but with the current political environment here in the United States, I would rather set myself on fire than get diagnosed. Story 18. I am not undiagnosed anymore, but I was always sure there was some sort of bleeding issue because of easy bruising, slow clotting, and severe iron problems. Mostly, doctors just told me to gain weight. Yes, I had a genetic test done, and I am an asymptomatic hemophilia carrier. Story 19. Lupus. I have every single symptom, including the telltale butterfly rash and 2 hospitalizations for random acute kidney injury, but my laboratory results are always within normal range. After 10 years of this, I finally accepted the fact that I am not going to live as long as my peers, and I stopped asking for help. Story 20. Everyone says autism, but multiple professionals have told me it is very likely over the years. I had a chance to get tested for free as a teenager and missed the opportunity. I do not have thousands of dollars to spend on an adult autism assessment, and if I did, I would save that money for other things. Can you guess which country I live in? Story 21. Lately, multiple sclerosis has been on my mind. I have always experienced various neurological issues throughout my life. Sometimes the symptoms come and go. It feels like my nervous system is wired incorrectly. In my early 20s, I sought answers but never found any. I had a brain scan that showed no multiple sclerosis lesions, and I was dismissed from the neurology clinic with a shrug and the words, "I don't know." I was diagnosed with fibromyalgia around that time for separate symptoms, but it never explained the nervous system problems. In my 30s, I was diagnosed with complex regional pain syndrome. I thought that might explain my issues, but the more I learned, the less it seemed to fit. I decided to live with it, but over the past year, many symptoms have worsened. Combined with other issues, I have spent a lot of time researching possible causes. One day, I came across an article about multiple sclerosis and was shocked to see so many of my symptoms listed and to read about many people who have had similar experiences over a long time. Unfortunately, I have yet to find a doctor who will listen. I am currently struggling with a separate, very disabling condition that takes priority, even when I try to bring attention to the possibility of multiple sclerosis. Story 22. Dyspraxia is likely. I misjudge everything, spill everything, and have to work very carefully to avoid making a mess. Story 23. Right now, my doctor is pretty sure I have mononucleosis but told me not to bother testing for it. The neck pain is unbearable, and it is not from lymph node swelling, as it should be if it were mononucleosis. That is kind of worrying me because I don't know what it is from. I asked about meningitis and they said if it were meningitis, the pain would have come on suddenly and been much stronger, instead of ramping up over a few days like it has been. I feel terrible and apparently will for weeks. I am hoping the neck pain goes away soon because I am taking the final classes I need for my degree right now, and I can barely sit at my computer. I am so behind on schoolwork. It is scary. Story 24. I feel like maybe I am an evil genius, but I do not want to bring it up with my general practitioner in case a diagnosis brings unwanted attention to my diabolical master plans. Story 25. I have polycystic ovary syndrome, anxiety, and depression. I feel there is something else, I just know it. Do all my symptoms get explained by these 3 conditions? Yes, but there is still something more. Story 26. Face blindness made gym class a nightmare. One time, I passed the ball to someone on the other team because I thought he was someone else. Story 27. Autism, but I am in line to have that investigated. It will only take another year and a half to start that. Story 28. Autism, more specifically autism and attention deficit hyperactivity disorder. I already have a diagnosis of attention deficit hyperactivity disorder, but when I went to the assessment appointment, they said they did not know how to test me properly for autism because of my transgender status. They said I just have severe anxiety, depression, and attention deficit hyperactivity disorder. I did not even get to talk to the diagnosing doctor face to face. It was a bad experience. Story 29. I think there is something wrong with my uterus. My periods are short and I seldom get cramps, but I have very heavy periods full of large clots. The cramps I do get are unbearable. I bleed through superabsorbency tampons in less than 2 hours. Clots the size of half-dollar coins and bigger fall out of me every time I change tampons. I am 24 years old, not on any medications that would affect my period, and the only surgery I have ever had was a bilateral salpingectomy in 2022. I had pelvic inflammatory disease when I was 18, but it does not feel like that is what this is. Story 30. I think I have long coronavirus disease, whatever that means. After my most recent bout, I have been forgetting the most basic things, and I used to be the most organized and punctual person. Story 31. Endometriosis. So far, every general practitioner I have seen, who happen to be older males, dismisses me and says painful periods are a normal women's issue, despite my detailed explanation that these are not just periods. Story 32. Some other mental disorders. Polycystic ovary syndrome, possibly mild endometriosis. Probably something like osteoarthritis as well, which my mother has and is apparently hereditary. Story 33. Postural orthostatic tachycardia syndrome. All symptoms match completely. Other people with postural orthostatic tachycardia syndrome from forums and public talks can corroborate. I am still waiting for the tests 2 years later because I cannot afford private healthcare. Story 34. A broken heart. Otherwise, many things and friends indicate that I am on the autism spectrum. Most of them are not doctors or psychologists, and I have never been officially tested. Story 35. Multiple sclerosis. I am starting the process now. It is either that or I have lost more discs or vertebrae, but I am scared it is multiple sclerosis. My vision has been changing. My body experiences what feels like electrical stabs randomly. I have pins and needles constantly in my hands and feet. My body no longer feels like mine. I am also having issues thinking and conveying thoughts. I am scared, but I still want to know. Story 36. Endometriosis. I have basically all the symptoms and have family members who are diagnosed. But every time I speak to my general practitioner, I am prescribed the pill with no referrals, so I have given up trying. Story 37. I believe that when I was born, the doctor incorrectly classified me as a human, even though I am a cat. Story 38. I think I have some kind of intestinal disorder. I get quite a bit of pain in a few spots if I am backed up, gassy, or sometimes for no reason at all. I am scared to bring it up, but I also need to because it has been getting more serious over the years. Story 39. Ehlers-Danlos syndrome. I have tried going to a geneticist, rheumatologist, and orthopedic specialist, but all of them said they do not perform these assessments. It is frustrating because I have many health problems that are likely due to Ehlers-Danlos syndrome, but I do not know where or how to get appropriate support. Story 40. Autism in women is often overlooked because women are not studied as extensively as men in healthcare. Women are expected to fit into the same guidelines as men. It is recognized that women are likely significantly underrepresented in autism diagnoses. Story 41. Fibromyalgia. My body will absolutely ache for no reason whatsoever. I have had very extensive blood work and other testing with no positive results, which is great. But why do I hurt so much? It used to occur just here and there, but now it happens more often than not. This is embarrassing because I didn't think it existed until about the last 10 years. Story 42. I am a therapist. I have long suspected that I have autism, but I will never have it diagnosed. It does not provide access to any resources that I need, and I fear the social and political consequences under the current administration. Story 43. Multiple sclerosis. My symptoms make sense for it. My cousin has multiple sclerosis. My uncle, who is not my cousin's father, has it too. It is clearly a condition on that side of the family. I have mentioned it twice and been laughed at both times by a doctor. Given the eye pain, the random numb patches on my body, the constant muscle cramping, and the fatigue, I am just told to drink more water and try yoga. Story 44. Ehlers-Danlos syndrome and fibromyalgia. Chronic pain, hypermobile joints that dislocate easily, lightheadedness, the whole range of symptoms. It is very frustrating to explain to people that, yes, my joints are just like that, and no, it does not hurt right now, but it sure will if I move them the wrong way. Story 45. I experience frequent dizziness and nausea, and no doctor has been able to determine the cause except for some vitamin deficiencies. I have been taking vitamins, but the symptoms remain the same. I am worried that one day I will be diagnosed with cancer, and it will be at an advanced stage with no chance of recovery. Story 46. Lymph-related itching only occurs under both armpits and on the left side of the groin. I have tried different deodorants, bath soap, and shampoos with no changes. This has been ongoing for over a year. Story 47. For some reason, if I eat any food that contains mono and diglycerides as an additive, I experience horrible, violent diarrhea within an hour or so. It is similar to severe lactose intolerance levels of stomach problems. I can digest fatty foods without this happening, so I have no idea why this issue only occurs when these additives are present. I am certain that they are the cause, as I have fully excluded them from my diet, and the episodes have completely stopped. However, this prevents me from going to restaurants, eating out, or trusting any food given to me unless I can read the labeling. It also makes me look like someone who is overly cautious about food additives. There is definitely an undiagnosed issue somewhere, but every doctor I have spoken to is unable to explain why this occurs. If anyone has any ideas, I am open to suggestions. Story 48. Autism, high functioning, and attention deficit hyperactivity disorder. I actually tried getting diagnosed a while back, but apparently the place I was referred to did not offer those tests. Where can I go to get properly evaluated? Story 49. Cancer. My dad died of cancer and my mum died of cancer. So the chances are I will die in this lifetime from that horrible disease. However, in a very strange twist of fate, a fun fact if you would like to call it that, my dad died on the 8th of May, a month before I was born. My mum died on the exact same date, the 8th of May, 40 years later, a month before my 40th birthday. So I guess I will leave here on the 8th of May, whatever year the Grim Reaper decides to get me. Story 50. Autoimmune disorder. Every day I consistently break out in hives and rashes all over my body. I have allergies, but the allergist I consulted told me there is less than a 10% chance they will ever figure out what it is. It is not something I am ingesting, and allergy shots probably will not cure it. This all started in December of last year when I weaned off an allergy medication, hydroxyzine, that I had been taking for only a few months for sleep issues. Prior to that, I had never had rashes or hives before, and my allergies had always been very manageable. There does not seem to be any sort of trigger as I switched to hypoallergenic detergents and cleaners, live in a mold-free environment, my worst allergy according to testing, and due to my job, I am rarely outside where I would be exposed to grass and tree allergens. I am also allergic to dogs and cats, but I can pet them without any skin reaction. I am very unsure of what it could be since it feels like I am sensitive to the air. I have to take Allegra constantly. I do not have any relief when I am on trips abroad. I also have endometriosis, which I have been told is a risk factor for an autoimmune disorder. I am very open to any advice or possible leads if anyone else has experienced this. Story 51. Autism and some form of auditory processing disorder. I do not know where to get tested for the latter or how it would help. Story 52. Hoarding. I don't have a lot of things, but I have the hardest time throwing things away that may be useful in the future. Story 53. Atrial fibrillation. My mom, sister, and a couple of my aunts all have it. I have described what happens to them sometimes, and they tell me to see a cardiologist because it sounds like atrial fibrillation. I have done 2 separate week-long Holter monitor tests and other tests to try to catch it, but it never happened during those tests. Story 54. Autism. My son was diagnosed over a year ago, and now that I have done my research on it, I realize that is me for sure. My heart hurts for my younger self who never understood why so many things were so hard and never received help for any of it. My son will have all the help I can possibly give him. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.